Welcome back. Well, the coronavirus continues to infect more and more people each and every day, and the frontline medical workers are working as hard as they possibly can to help all of us affected, and we just want to say thank you to all of them from the bottom of our hearts. And joining us now to talk about the coronavirus and what medical officials need us to do to help, we've got the Chief Medical Officer at Essentia Health, Dr. Rich Vetter. Dr. Vetter, welcome to the show. It's great to have you, sir.
Great. Good morning, Chris. Thanks for having me.
So there seems like every week some new news about the vaccine. Just want to see if you can give us the latest update, your thoughts, and then you have any ideas what the distribution plan is here in North Dakota?
Yeah, so we've been in daily contact with the state health department for the last several months, actually, planning the distribution and how to get the vaccine out as quickly as possible when it's available. You may be aware that the FDA will be reviewing the Pfizer vaccine, which is the first one expected to be available on December 10th. And they're expecting that the shipments will probably occur even the next day. And so we're hoping by mid-December, we will have vaccine available and ready to distribute and administer to the residents of North Dakota.
I just want to get your assessment here. Dr. Fauci often say, hey, look, we've gone through a rigorous process here. Just because we did it faster than normal doesn't mean that we've done anything to impede on the safety of this vaccine. And he says there's an independent group that's doing the research on it, if you will. So just your take and thoughts on how fast this has been done and what people can expect when we finally get it.
Yeah, I think the thing that people need to be aware of is that the vaccine technology is certainly different than it was 10, 20, and 30 years ago when we were developing other vaccines. If you look at the number of patients who've actually been part of the phase 3 trials, it's almost 70,000 or over 70,000 individuals who've been through those trials. And that's very similar to what we've seen when other vaccines come to market. I think because of all the additional resources that were spent by the government and others on this, it really kind of helped accelerate that. But again, the technology and the platforms used to make the vaccines are much improved and allow for this quick turnaround time. As you know, there's a lot of scrutiny around the vaccine, and it's being looked at very carefully by multiple people, including the FDA, the CDC, and we'll be following their lead in administering the vaccine and how to prioritize who gets it first.
You just read my mind, Doc. I was going to ask you, I'm assuming that people like yourself and the frontline healthcare workers would be first in line as far as priorities, but what is the plan for prioritization and how you can execute that?
Yeah, so the initial recommendations coming from the CDC has been to really look at the frontline workers first, so which would include healthcare workers, particularly those in direct patient contact. That would include healthcare workers that work in long-term care, and then that would be followed by other essential personnel like police, fire, emergency personnel, as well as maybe teachers, as well as residents of long-term care facilities as well. And then the next tiering after that would include probably people with chronic medical diseases or high-risk individuals who also we want to get vaccinated as quickly as possible.
Good deal. Let's talk about, finally we're starting to see the 14-day average in North Dakota go in the right direction. How is it impacting hospitalizations? Are you feeling better about the resources available in case there is another surge?
Yeah, I think certainly the numbers give a little bit of sense of hope that things might be turning around. We're a little bit leery still of the recent holiday. We won't see the effect of that and the travel and how well people did or didn't do in interacting with one another and potentially contracting the virus. So I think 2 weeks from now or 2 to 3 weeks from now, we'll have a much better sense of where that's at. And then, of course, we're heading into the Christmas holiday, which again will be asking people to limit their interactions and the size of their gatherings, which will also be a challenge. But we see this, that people are heeding the warnings and have been, I think, doing a much better job of masking and following those distance guidelines and following good hand hygiene.
Doc, I'm curious, just because of the way you see the world differently than most people with your education and background, as you have seen what's taken place over the past, 8-9 months, what surprised you the most? What's one thing you've been like, boy, I didn't see that coming?
Yeah, I think the nature of the virus, some people have said it's almost like a chameleon. You can have either no symptoms to very severe symptoms. to moderate symptoms. And just the way it presents in various patients and various individuals is so varied and so different. And I think that's made it a challenge to know exactly when you might be, actually carrying the virus and potentially even spreading it to others. So that's been a real challenge. I think the other thing is just remembering and reminding all of us to go back to, I think, what we knew actually pre-pandemic was the importance of good hand hygiene, covering your face if you're sneezing or coughing, staying home if you're sick. And again, just those basic public health measures that we all knew about, but just needed to kind of remind ourselves and do a much better job at that. And hopefully that'll be one of the learnings out of this, that we'll continue to practice some of those behaviors even after the pandemic has subsided.
Yeah. Dr. Vetter, thank you so much for the insight and the time. We really, really appreciate it.
Thank you for having me.
Thank you. All right, stick around. We got a lot more coming up right after this.